I got a request in the comment section under one of my videos for me to talk about a herb called ashwagandha. Uh, so that's what I'm going to do here. I should also point out that I've written about ashwagandha at least a couple of times in my Applied Metabolics newsletter, especially in relationship to its use as an ergogenic aid and to possibly increase testosterone, which I'll mention briefly in this video. Ashwagandha is it has a commonality with other herbs in that it's classified as an adaptogen. That means that it helps the body adapt to stress. It's one of the most important herbs that are used in something called Ayurvedic medicine, which is very popular in India. It's been used for thousands of years. In fact, it's been used. Ashwagandha has been used in India for over 3,000 years to relieve stress, increase energy, and improve concentration. The word ashwagandha itself comes from the Sanskrit language, and it translates into smell of a horse, because supposedly it kind of somehow smells like a horse, and it does not. I can tell you, having used ashwagandha for a couple of years, doesn't smell very good. And so I guess it does smell like a horse. And also a secondary reason why they call it that is because it's supposed to make you as strong as a horse. And as we will see, there is some truth to that. The botanical name, if you ever look up ashwagandha in the, for example, the Public Library of Medicine, very often they use the botanical name, which is I'm going to make sure I get this right, Withania somnifera. Withania somnifera. It's also known by several other names, such as Indian ginseng and winter cherry. Many of its health benefits are attributed to its high concentration of withanolates. Now, this is an important point. The main beneficial compounds that are found in ashwagandha are these various withanolates. And this is very important when it pertains to supplements, which I'll get this a little later, because some supplements that are touted to be very potent forms of ashwagandha are actually contain almost no withanolates. And I'll talk about that a little later in detail. But the withanolates have been shown to fight inflammation and also to prevent the growth of tumors in several studies. In other studies, ashwagandha has been shown to help lower blood sugar levels, which means that it could be a preventative against the onset of type 2 diabetes mellitus, which is increasing in epidemic proportions all over the world. A test tube study found that ashwagandha increased insulin secretion and it improved insulin sensitivity in muscle cells. Several studies have confirmed its ability to reduce blood sugar levels in both healthy people and in those with diabetes. In addition, a study that lasted a month, people with schizophrenia, those who were treated with ashwagandha had an average reduction of fasting blood sugar of 13.5 milligrams per deciliter compared to 4.5 milligrams per deciliter in those who ingested a placebo instead of ashwagandha. In another small study of 6 people with type 2 diabetes, supplementing with ashwagandha for 30 days lowered fasting blood sugar levels as effectively as an oral diabetic medication. Okay. What else do I have to tell you here? Hold on a second. Wait a minute. I got a lot of notes on this stuff here. Hold on a second. Wait. Hold on a second. Okay, here we go. Okay. Anyway, so I talked about the schizophrenia subject. Okay. Wait a minute. Ashwagandha can also provide some anti-cancer effects, as I said. With that ingredient I talked about, the major ingredient, it's known to help to shrink tumors. And sure enough, animal and test tube studies have found that ashwagandha helps induce apoptosis. Now, apoptosis is a kind of a programmed self-destruction of cells. Cells can determine whether, or the body, I should say, can determine whether cells have become abnormal, such as cancer cells. And what happens is that this promotes an initiation of a series of events in the cell that result in the self-destruction of the cell. Scientifically, it's known as apoptosis. Ashwagandha also impedes the growth of new cancer cells in several ways. It's believed to generate what they call reactive oxygen species, also called free radicals. These are toxic to cancer cells, but not to normal cells. Although that's not absolutely true, having an overabundance of reactive oxygen species can be toxic to cells. Ashwagandha can also cause cancer cells to become less resistant to apoptosis. Animal studies suggest that it might help treat several types of cancer, including breast, lung, colon, brain, and ovarian cancer. And in a 2014 study, mice with ovarian tumors treated with ashwagandha alone or in combination with an anti-cancer drug had a 70 to 80% reduction in tumor growth. The treatment also prevented the spread of cancer to other organs. That's called metastasis. Although there are no studies to confirm these results in humans, the results to date is encouraging. Another feature of ashwagandha is that it helps to control cortisol. Cortisol is familiar to many bodybuilders and athletes as an anti-catabolic hormone released by the adrenal cortex. It stimulates the breakdown of muscles. Of course, cortisol is also a stress hormone that helps the body to deal with stress. You have to have cortisol to live, but in some cases, cortisol levels may become chronically elevated, which can lead to high blood sugar levels and increased fat storage, especially in the torso and the abdomen. Studies have shown that ashwagandha can help reduce cortisol levels. In fact, that's probably one of the reasons why it helps to boost testosterone to a certain degree, because the high levels of cortisol oppose the release of testosterone. In one study in chronically stressed adults, those who supplemented with ashwagandha had significantly greater reductions in cortisol compared to the control group. Those taking the highest dose had a 30% reduction on average. Other researchers reported that ashwagandha blocked the stress pathway in the brains of rats by regulating chemical signal in the nervous system. Specifically, it interacts with the inhibitory neurotransmitter Gaba aminobutyric acid, or GABA, in the brain. Gaba is the primary inhibitory neurotransmitter. It's involved in the onset of sleep and in the reduction of stress. And ashwagandha interacts with Gaba, which means two things. It helps lower the feelings of stress. If you're under a lot of stress, ashwagandha will help. And it'll also help you fall asleep because, again, it interacts with the GABA receptors in the brain that kind of tone down the brain and help it relax. Several controlled studies have shown that can effectively reduce symptoms of people with stress and anxiety disorders. That's ashwagandha. In fact, in one study that lasted about 2 months, 64 people with chronic stress, those in the supplemental group reported a 69% average reduction in anxiety and insomnia compared to 11% in the placebo group. In another 6-week study, 88% of people who took ashwagandha reported a reduction in anxiety compared to 50% of those who took a placebo. So it worked considerably better than a placebo. Ashwagandha supplements may also have powerful effects on testosterone levels and reproductive health. For example, a study of 75 infertile men, the group treated with ashwagandha, showed increased sperm count and motility. That's movement of sperm. What's more, the treatment had a significant increase in testosterone levels. Now, I want to point out at this point that, just so you don't get confused, ashwagandha is not a substitute for testosterone. It will never raise your testosterone levels to the extent that taking straight testosterone or anabolic steroids. It causes a slight elevation, about maybe 15% increase in testosterone, which is pretty good if you are low in testosterone to begin with. That 15% rise could make the difference between having a normal level of testosterone and a subpar level of testosterone. Researchers who looked at ashwagandha also reported that it increased antioxidant levels in the blood. In another study, men who received ashwagandha for stress experienced higher antioxidant levels and better sperm quality. After 3 months of treatment, 14% of the men's partners had become pregnant. Research has shown that ashwagandha may improve body composition and muscular strength. In a study to determine a safe and effective dosage for ashwagandha, healthy men took 750 to 1,250 milligrams per day of pulverized ashwagandha root, and they gained, nearly all of them gained muscle strength after 30 days on that dosage range of ashwagandha. In another study, those who took ashwagandha had significantly greater gains in muscle strength and size. It also more than doubled the reduction in body fat percentage compared to the placebo group. So ashwagandha is actually a pretty good herb to take for those engaged in bodybuilding and fitness. Several studies have also shown one reason why people lose muscle with age is because of something called systemic inflammation. They get has a lot to do with how much body fat you have, because body fat releases proteins called adipokines, which there's more than 100 of them. Most of them tend to cause inflammatory reactions in the body, which lead to systemic inflammation. Systemic inflammation has a catabolic effect in muscle, and in a large part, it explains why a lot of people over the age of 40, especially those who don't exercise, lose muscle with every particular year. It's a constant loss of muscle course related to systemic inflammation. Well, several animal studies have shown that ashwagandha helps decrease inflammation. Studies in humans have found that it increases the activity of natural killer cells, which are immune cells that fight infection and help you stay healthy. It has also been shown to decrease inflammatory markers such as C-reactive protein. The elevated levels of C-reactive protein are also related to higher risk for cardiovascular disease. In one controlled study, the group who took 250 milligrams of standard ashwagandha extract a day had a 36% decrease in C-reactive protein on average, compared to a 6% decrease in the placebo group. Hold on a second. Wait, hold on a second. So I want to just talk about the testosterone here. Let me get to those notes here. Hold on a second. Wait a minute. Hold on a second. Wait a minute. Hold on. Hold on a second. Talked about cortisol levels. Hold on. My notes got all messed up. I don't know how this happened here. Hold on. It can also reduce symptoms of depression. There's not a lot of studies on this, but a few studies suggest that ashwagandha can help relieve depression because, again, when cortisol levels get high, you tend to get depressed. And in one controlled study that lasted for 2 days, in stressed adults, those who took 600 milligrams of high concentration ashwagandha per day reported a 79% reduction in severe depression, while the placebo group reported a 10% increase. The study, you got to look at it with a grain of salt because only one of the participants in the study had a history of depression. So, that one you can kind of throw it out. I talked about, the effect on testosterone. I wanted to go a little detail. In another study, men who received ashwagandha for stress, I already talked about that one. Sorry. Oh, here it is. Muscle mass and strength. Talked about that. Geez, my notes really got messed up. Hold on. It can lower cholesterol and triglycerides, which is a anti-cardiovascular effect. Ashwagandha may improve heart health by reducing cholesterol and triglycerides. Animal studies have found that it significantly decreases blood fats. One study in rats found that it lowered total cholesterol by as much as 53% and triglycerides by nearly 45%. Human studies have shown less dramatic results, but they have observed some pretty impressive improvements. In a 60-day study in chronically stressed adults, those taking the highest dosage of standardized ashwagandha extract experienced a 17% decrease in so-called bad low-density lipoprotein cholesterol and an 11% decrease in triglycerides. Some studies say that, ashwagandha, in the Ayurvedic medical usage, it's also used as a brain stimulant. It's supposed to increase memory, but the truth is, human studies show only a little bit of research in this area. In one study, healthy men took 500 milligrams of standardized extract daily, and they reported significant improvements in their reaction time and task performance compared to men who received a placebo. Another 8-week study in 50 adults showed that taking 300 milligrams of ashwagandha root extract twice daily significantly improved general memory, task performance, and attention. Now, so one thing I have to point out about ashwagandha, which can have either good or bad effects depending on your point of view, ashwagandha is a very potent natural thyroid stimulant. I've seen studies where people with hypothyroidism, which is low thyroid output, when they take ashwagandha, they actually get a normal level of thyroid production, because what ashwagandha does is it increases the inactive or relatively inactive, or let's say prohormone form of thyroid, which is called T4. Ashwagandha stimulates its conversion into T3, which is the active form of thyroid. Some of you bodybuilders might know that the drug Cytomel is a direct form of T3. But those on medication for thyroid disease should be careful when they're using ashwagandha, because it can increase thyroid hormone in some people, where you can actually slip into hyperthyroidism, which is too much thyroid. One study showed that ingesting 300 milligrams of the KSM66 type of ashwagandha boosted levels of thyroid hormone in those showing thyroid output. That's the study I just mentioned. However, one Dutch woman who used ashwagandha, she developed hyperthyroidism after ingesting ashwagandha for several weeks and taking it with thyroid medications, which again, she kind of doubled up on, and she had excessive amounts of thyroid. It could put a lot of strain on your heart. Not good. As for doses, what's the correct doses? The daily doses for the root powder form are 1 to 6 grams a day. For extracts, it's 500 to 1,500 milligrams a day. However, recent testing of ashwagandha supplements by the website consumerlab.com found that 56% of the products tested hardly contained any of the primary active ingredient, namely withanolides. The Sensoril brand, which is one of the more popular brands, that contains KSM66, was found to contain only 1.1 milligram of withanolides per serving. A serving of that is 2 capsules. Now, the Sensoril brand claims to contain 5% withanolides. In fact, this analysis showed it contained less than 1%. The one that tested the best as far as withanolide content was the Nature's Way brand, and that showed a content of 95.3 milligrams in 3 capsules. However, there's a case history of someone who used that particular brand of ashwagandha. Actually, there was 3 cases that developed liver problems. Within 6 months after getting off the ashwagandha, the liver problems receded. Other possible rare side effects include headache, sleepiness, gastrointestinal upset, nausea and vomiting. Ashwagandha can also cause allergic reactions in some people that include rash, itching, nausea, wheezing, or difficulty breathing. People with asthma, if you're not taking asthma medication, you got to be careful with ashwagandha. I have asthma. I do take medication. There are times when I've taken a little bit too much ashwagandha and it has impeded my breathing a bit, because it can cause a little bit of a tightening of the lungs due to allergic reactions. The normal dose, I should also point out, doesn't cause me any problems. I've been using ashwagandha for years. I take one during the day, and I usually take one before I go to sleep because of the effect with Gaba. It stimulates the Gaba receptor, which helps it induce sleep. So I take a 500 milligram capsule before I go to sleep. Another study showed that ashwagandha taken for 6 days. Oh no, this is one guy. It's a case study. One guy ingested 5 grams of ashwagandha. That's a massive amount. There's no reason to take that much. He ingested 5 grams of ashwagandha for 6 days, and he developed burning, itching, and skin discoloration, which disappeared when he stopped ingesting the ashwagandha. Ashwagandha could also lower blood pressure and has to be used with caution in those who are taking blood pressure medication. As I said, it can also lower blood glucose levels. So diabetics using drugs to lower blood glucose also have to be careful. There was another case study showed that 2 men in India reported developing heart rhythm disturbances following the use of ashwagandha. This involved a rapid heartbeat. Their hearts started to beat very rapidly. I don't know the dosage. They probably overdosed on the ashwagandha. Pregnant or nursing women should not ingest ashwagandha, and it should be used with caution. And those with liver and kidney disease, or those on any type of blood thinning medications. So I should also point out that, as I said earlier, the most recent study which was published this year, and related to ashwagandha and testosterone, it was given to obese, overweight men, and it showed that the ashwagandha increased their testosterone levels an average of 14.7%. Which is not bad, but nothing compared to anabolic steroids or testosterone itself. Might give you a little bit of boost in testosterone. If you're naturally low in testosterone, it might help a bit, but I wouldn't really call it a testosterone booster, because the 14.7, it's not that impressive, to be honest with you. And that's about it for ashwagandha. Uh, if you want the latest information about nutrition, exercise science, sorry about this video. I took a bunch of notes and I must have dropped them on the floor. They all got messed up. So I apologize for that. I had to find, I was lost in space here trying to find, which thing to talk about next. But anyway, I tried to do the best I can. Anyway, that's an overview of ashwagandha. If you want the best information on nutrition, exercise science, hormonal therapy, women's health and fitness, anti-aging technique research, fat loss techniques that work, all the truth about food supplements, which ones work, which ones don't, exercise science, subscribe today to my Applied Metabolics newsletter, www.appliedmetabolics.com. You'll have my 57 years of constant study and research, including my empirical experience of being in the gym for that long. I trained for, believe it or not, 58 years. So I know what works and what doesn't. I'm going to tell you in this newsletter. I was a bodybuilding writer for over 32 years. I interviewed all the top bodybuilding champions. I know all the tricks. I know all the secrets of the game. And I'm going to impart this only in my Applied Metabolics newsletter, nowhere else. Each issue is averaging anywhere from 40 to 50 pages. It's more like getting a monthly ebook. There's no ads. There's no advertisements. I'm not trying to push any particular supplements. It's just pure, unadulterated, fact-based, scientifically evidenced information. So, subscribe today. And when you subscribe, I will send you an invitation to join my private Facebook page for Applied Metabolics subscribers. Each day I post new information on nutrition, exercise science, medical topics. It's kind of interesting. Also, I have an email portal on my Applied Metabolics site where I will respond to questions submitted only by current subscribers to my Applied Metabolics newsletter. Short questions, please. I can't give you 10-page answers. I can't do that. So the question, and if you're not a subscriber, don't bother sending me a question, because my time is limited. I can only answer the people that support my work, the subscribers. You're welcome to leave comments under these videos. You can leave suggestions if you want. This video itself was based on a suggestion. Somebody wanted me to do a video on ashwagandha, so I do respond to comments about future video suggestions. Anything else you want to say, feel free. I may or may not answer questions that are submitted as comments. Most of the time I don't, and it's because of time constraints. But anyway, that's about it. Thanks for listening this long. And if you want to have the best friend you'll ever have, go to your local shelter, adopt a dog. They are the best stress relievers. They beat out any herb, including ashwagandha. So take